Hello everyone and welcome back to the channel. Today we are talking about something that shows up in almost every meal we eat and even when we don't realize it, and that is sodium. Salt is one of the most common ingredients in our food, but if you're living with chronic kidney disease, the amount of sodium you eat can have a major impact on your health, your energy, and even the progression of chronic kidney disease. This video will help you understand why sodium matters, how your kidneys normally handle it, and what changes with chronic kidney disease, and simple ways to lower your sodium without eating boring or bland meals. Before we talk about sodium, we need to talk about the organs we are trying to protect, the kidneys. Your kidneys are your body's master filters. These two fist-sized organs work all day, every day, to filter waste, remove extra fluid, regulate your blood pressure, balance your minerals, including sodium and potassium, among other functions. When your kidneys are healthy, they remove the extra sodium easily. Eat something salty, the kidneys flush it out in your urine. It's a smooth and automatic process. However, when you have chronic kidney disease, then there is a problem. In chronic kidney disease, this filtering system becomes damaged. The kidneys can no longer get rid of extra sodium the way they should. So what happens? The sodium stays in your body, and when the sodium stays in your body, it attracts more water. And so your body holds on to more water as well. And this extra water causes multiple serious problems, which include high blood pressure. So imagine your blood vessels are like garden hoses. Extra fluid means extra pressure. High blood pressure is dangerous because it damages your kidneys even further, creating a cycle that makes the chronic kidney disease progress faster. The excess salt and water retention leads to swelling in the body. The extra fluid can settle in your hands, feet, and face, and this swelling is called edema. And it can be quite uncomfortable, and it is a sign that your kidneys are possibly struggling. 3, it can cause shortness of breath. The excess fluid, which is retained because of excess sodium, can even collect in your lungs, making it harder to breathe. When that happens, it becomes a medical emergency, which is why it is very important to control sodium in patients who are living with chronic kidney disease. So how much sodium should you have? For most people, it is recommended that you should limit your sodium to less than 2 grams per day or less than 5 grams of table salt per day. But if you have chronic kidney disease, your recommended amount is usually lower, often less than 1.5 grams per day. This is less than a teaspoon of salt for the entire day. Your kidney doctor or your renal nutritionist or dietitian can give you the exact amount that is right for you. And here's the tricky part. Most of the sodium that we eat doesn't come from the salt shaker. It actually comes from your packaged, processed, and restaurant foods, where salt is added for flavor and preservation. So let's become sodium detectives and uncover the biggest hidden sources of sodium and what to avoid. So one is your processed and cured meats. So the high sodium foods include your bacon, sausages, deli meats, ham, pepperoni, and hot dogs. So how do you avoid those? You can avoid those by choosing fresh meats, poultry, or fish, and season with herbs or spices. The second category of foods is your canned foods. like your canned soups, vegetables, and sauces, are often loaded with sodium. So how can you avoid those? Look for the no salt added, or rinse your canned vegetables before cooking, or just eat the fresh vegetables. The third category of foods are your convenience and fast foods, your frozen dinners, ramen, fast food meals, and pizza are some of the biggest sodium bombs out there. So try and cook at home when possible, where you can control the salt. Then things that a lot of people have, the salty snacks, your potato chips, pretzels, salted nuts, crackers, and these add up to the sodium load very quickly. So choose unsalted versions, or if you want to snack on fresh fruits and vegetables. The fifth category are your sauces and condiments, like soy sauce contains very high amounts of sodium, ketchup, barbecue sauce, salad dressings. So always read the labels, choose the low sodium versions, try the fresh herbs, lemon juice, garlic, or pepper to add flavor. The sixth category are your dairies and breads. Your cheese, buttermilk, and even certain breads or cereals may be surprisingly high in sodium. So always compare labels and choose lower sodium options. And these are always available. A special warning: salt substitutes, which have been marketed a lot. Many salt substitutes replace sodium with potassium chloride. And remember, that is even more dangerous for people living with chronic kidney disease who are often asked to limit potassium. So always talk to your kidney doctor or dietitian before using any salt substitute. Living with kidney disease can be challenging, but reducing your sodium intake is one of the most powerful steps you can take. It helps you control your blood pressure, reduces retention of water and swelling in your body, protects your heart, and slows the progression of chronic kidney disease. Start small. Read one extra food label this week. Try seasoning with herbs instead of salt. Cook one meal at home instead of ordering out. Remember, every small change protects your kidneys. Work closely with your doctor or dietitian to create a plan that keeps your kidneys healthy, one meal at a time. Thank you for watching, and always take good care of yourself. If you have liked this video, please like, share, and subscribe to my YouTube channel. Thank you.